What if your blood sugar is running higher than it should be, but you don't actually feel sick? High blood sugar can sometimes develop gradually, and some people may notice very few symptoms at first. Today, we're looking at 7 warning signs that could be worth paying attention to, and the last one is surprisingly easy to dismiss. Blood sugar, also called blood glucose, is the main sugar your body uses for energy. After you eat, your body normally works to move glucose from your blood into your cells. Insulin plays an important role in that process. But when blood glucose stays elevated over time, it can affect different parts of the body. The important thing is this: these symptoms don't automatically mean you have diabetes or high blood sugar. They can have many other causes. The only way to know what's happening is through appropriate testing and medical evaluation. So what might your body actually notice when blood sugar stays elevated? The first sign is one that many people simply blame on the weather, exercise, or not drinking enough water. Have you suddenly started reaching for water again and again, even when the weather isn't especially hot? Increased thirst can happen when blood glucose becomes too high. When glucose levels rise, your kidneys work to remove some of that excess glucose through urine, which can increase fluid loss and leave you feeling unusually thirsty. When blood glucose rises above the level your kidneys can efficiently reabsorb, glucose can spill into the urine. Water follows that glucose, increasing urine production. This is one reason high blood sugar may be associated with both increased thirst and more frequent urination. But increased thirst doesn't automatically mean your blood sugar is high. Dehydration, salty foods, intense exercise, certain medicines, and other health conditions can also make you thirsty. If unusual thirst continues, especially alongside frequent urination or other symptoms, it's worth discussing with a healthcare professional. And here's where the pattern gets more interesting. Sometimes the thirst isn't the only change. You may also find yourself making noticeably more trips to the bathroom, especially at night. Maybe you've noticed something else lately. You're visiting the bathroom much more often than you used to, and if those trips are becoming especially frequent at night, it may be a pattern worth paying attention to. When blood glucose remains elevated, the kidneys may try to remove some of that extra glucose through urine. Because glucose draws water with it, the amount of urine produced can increase. This is called increased urination, or polyuria. Frequent urination isn't specific to high blood sugar though. Drinking a lot of fluids, caffeine, certain medications, urinary problems, and other conditions can also increase bathroom visits. So the symptom alone can't tell you what's causing it. But when frequent urination appears alongside unusual thirst, fatigue, or unexplained weight changes, that's a different pattern, and it's one you shouldn't simply blame on getting older. Now imagine your clothes suddenly feeling looser, even though you haven't intentionally changed your diet or exercise routine. Unexplained weight loss can have many causes, but when it happens alongside increased thirst and frequent urination, it deserves attention. When insulin isn't working effectively, or when the body doesn't have enough insulin, glucose may not enter cells properly to be used for energy. The body may then begin using stored fat and muscle for energy, which can contribute to unintended weight loss. But unexplained weight loss is not proof of high blood sugar. Thyroid disorders, digestive conditions, infections, medication effects, and other illnesses can also cause unexpected weight changes. If you're losing weight without trying, especially if the change is significant or ongoing, talk with a healthcare professional. And there's another clue that can sometimes appear alongside high blood sugar, one that has nothing to do with your weight or thirst. Your vision may suddenly seem different. Have you noticed that words sometimes look slightly blurry, or that your vision seems to go in and out of focus? Temporary blurry vision can have several causes, but changes in blood glucose can sometimes affect the fluid balance in the eye and temporarily change the way you see. When blood glucose changes significantly, fluid levels inside the eye can shift. That can temporarily alter the shape of the lens and affect focusing. In some people, vision may become blurry until glucose levels become more stable. Blurry vision doesn't automatically mean your blood sugar is high. Dry eyes, prescription changes, cataracts, eye disease, medications, and other conditions can also affect vision. Persistent or worsening changes should be evaluated by an eye care professional or doctor. But here's something important. High blood sugar doesn't only affect what you see, it can also change how your body feels, and the next sign may show up as unusual tiredness after even simple activities. Feeling tired after a long day is normal, but what if ordinary activities, walking up a few stairs, doing household chores, or even getting dressed, suddenly leave you feeling unusually drained? Persistent fatigue can have many causes, but it can also occur when blood glucose isn't being used effectively by your cells. When glucose can't move efficiently from the bloodstream into cells, the body may have less readily available energy. If blood sugar remains elevated, this can sometimes contribute to feelings of fatigue or weakness. However, fatigue is one of the least specific symptoms on this list. Poor sleep, anemia, thyroid problems, infections, stress, medications, and many other conditions can leave you feeling exhausted. That's why ongoing fatigue shouldn't be used to diagnose high blood sugar by itself. But there's another clue that may appear alongside fatigue, and unlike tiredness, you might actually notice it when you look at your body. Some people with high blood sugar may notice that cuts or wounds don't seem to heal as quickly as expected. And this next sign is particularly important because it may be something you can actually observe over time, not just something you feel. Have you ever had a small cut or scrape that seemed to take longer than expected to heal? Slow wound healing can have several possible causes, but persistently high blood sugar can interfere with processes the body uses to repair damaged tissue. Persistently elevated blood glucose can affect blood vessels and nerves, and over time it may interfere with circulation and the body's normal wound healing processes. That can make recovery slower in some people, particularly when diabetes isn't well controlled. But a slow healing cut doesn't automatically mean you have high blood sugar. Poor circulation, infection, smoking, certain medications, nutritional problems, and other health conditions can also affect healing. A wound that isn't improving or appears infected should be assessed by a healthcare professional. And now we've reached the final sign, one that can be especially easy to overlook because it doesn't always feel like a serious health problem at first. The final sign involves your skin and nerves, and it may feel completely unrelated to blood sugar until you understand the connection. Maybe your feet sometimes feel like they're burning, buzzing, or falling asleep, even when you've been sitting still. If this keeps happening, especially at night, it deserves attention. Persistently high blood sugar can damage nerves over time, potentially causing these unusual sensations. Over time, high blood glucose can contribute to nerve damage, particularly in the feet and legs. This type of nerve problem is often called peripheral neuropathy. The sensations can range from pins and needles to burning, numbness, or increased sensitivity. But here's an important point. Tingling or numb feet don't prove that your blood sugar is high. Nerve compression, vitamin deficiencies, alcohol use, certain medications, and other neurological conditions can cause similar sensations. Persistent or worsening symptoms should be evaluated rather than self-diagnosed. And here's the bigger picture. Increased thirst, frequent urination, unexplained weight loss, blurry vision, fatigue, slow healing, and unusual sensations in your feet can have different causes. But when several of these changes appear together, getting your blood glucose checked may be a sensible next step. But symptoms alone can't tell you whether your blood sugar is actually too high. So what should you do if you've recognized several of these signs? That's where testing becomes much more useful than guessing. If you've noticed several of these signs, don't try to diagnose yourself from symptoms alone. A blood test can give you much more useful information. Two common tests doctors use are fasting blood glucose and the A1C test. A fasting blood glucose test measures your blood sugar after you've gone without food for a specified period. The A1C test is different. It estimates your average blood glucose levels over roughly the previous 2 to 3 months. Your healthcare professional can decide which test or combination of tests is appropriate for you. One important point, a single abnormal result doesn't necessarily tell the whole story. Doctors may repeat testing or use another test to confirm what is happening, depending on the situation. That's why it's better to discuss results with a qualified healthcare professional rather than interpreting one number on your own. And there's one final question many people have after hearing these symptoms. Can you actually lower your risk through everyday habits? The answer is more practical than you might expect. You don't need to completely eliminate carbohydrates to support healthier blood sugar. A better approach is building balanced meals with vegetables, protein, fiber-rich foods, and appropriate portions of carbohydrates. Regular physical activity can help your muscles use glucose for energy and can support better blood sugar control. You don't necessarily need intense workouts. Walking, cycling, swimming, or other activities you enjoy can all be useful ways to stay active. Sleep matters too. Poor or insufficient sleep can affect hormones involved in appetite, metabolism, and glucose regulation. Aim for a consistent sleep schedule and talk with a healthcare professional if you're regularly struggling to sleep. For people who are overweight, even modest weight loss can improve insulin sensitivity and blood sugar control. But healthy weight looks different for everyone, so the goal should be sustainable habits, not extreme dieting or rapid weight loss. And perhaps the most practical habit is knowing your health numbers. Depending on your age, risk factors, and medical history, your healthcare professional may recommend checking blood glucose or A1C. Testing can reveal changes before symptoms become obvious. The key message is simple: increased thirst, frequent urination, unexplained weight loss, blurry vision, fatigue, slow healing wounds, and nerve symptoms can have many different causes. But if you're experiencing several of them, don't guess, get appropriate medical advice and testing. If this video helped you understand the warning signs better, subscribe to VitalBites for practical, evidence-aware health education, and tell us in the comments which signs surprised you the most. Educational content only. This video does not diagnose or treat any condition. If you have persistent symptoms or concerns about your blood sugar, speak with a qualified healthcare professional. Remember, these symptoms don't automatically mean your blood sugar is high. But when several changes appear together, they're worth paying attention to. Don't diagnose yourself from a YouTube video. Get the appropriate testing and speak with a qualified healthcare professional. If you found this video useful, subscribe to VitalBites for more evidence-aware health information and share this with someone who may find it helpful.